I cannot tell you medically that we have a cure for IBM, but the results that we are seeing, even with these patients that came to us from the United States, are very promising, and it is possibly that is not usually seen anywhere else in the world.
I was here on a mission trip with our church, and I had a bad fall that was just very unexplained, and I thought, what in the world was that all about?
In retrospect, the first indication that I had anything wrong was probably about 12 years ago. I had problems swallowing. Walking with my wife, she would hear my foot slapping on the street. Now, I, at that point in time, was walking the golf course 3 days a week and pretty fit, but it was really strange that my foot was slapping and nobody had any idea what it was. About 2 years after that, I had a bad knee, and when I went to my doctor, he looked at my thighs and said, "What on earth happened to your thighs?" The quads were basically just disappearing.
About 6 years ago, at the end of 2015, I was traveling and I was arriving to an airport to pick up my luggage, and I realized that I was having problems pulling the luggage off the carousel.
Would be weakness in my left hand, and that was about 7 years ago probably. I was working on the house, and I couldn't pull the trigger on my skill saw with my right hand. My daughter is a nurse in Chapel Hill, and that's where I went. I was on the phone with her, and I said, I just keep stumbling lately. And she said, well, tell the doctor that. Okay, it never, it was just something that happened. I didn't think about it. And then as we were talking, I said, I also have trouble swallowing sometimes. I said, tell the doctor that.
There's something, after a blood test, I just had an annual physical, and the blood work showed that I had elevated CK levels, which is an enzyme in the blood, I believe, that indicates that there's some form of muscle damage going on, or something that could be either muscle or neurological. And she was the first person that really said, you ought to get this checked out. But I just kept thinking, truthfully, I thought it was a process of I wasn't doing enough exercise, I wasn't working out hard enough, I needed to walk more, I needed to work on climbing steps. It really didn't truly dawn on me until 2015, wait a minute, there is something seriously wrong here, and this is just not right.
I am Ken Ross. I live in Southern California. I'm a retired executive in the private power business of building, owning, and operating power plants in the United States. I've had IBM since I was diagnosed in 2014, and came here to PERM to see if we can do something about it.
So my name is Bruce Mosier. I'm currently from Potawatomi, Hawaii, but I've kind of lived all over the mainland. 61, I've had careers in sort of overlapping engineering, woodworking, and construction.
Well, my name is Hana Caliph. I'm currently living in Monterrey, Mexico.
I'm Alan Spencer, and I'm from the El Paso, Texas area. I'm a 65-year-old man who deals with an autoimmune disease called inclusion body myositis, and that's why I've been coming here to the clinic.
Alan Spencer could have been dead by now, or in a wheelchair, or bedbound. That's what doctors back home in America told him 5 years ago.
When I started to notice a little something with my hands, they were kind of going like this, and I said, well, something's not right, but I didn't have any problem with strength, so I didn't think I had anything wrong. 2012 came, I had a fall, and I was like, well, that was unusual. 2014, I came again, I had a really bad fall. I was like, okay, there's something wrong.
Something wrong happened to be a rare inflammatory muscle disorder known as inclusion body myositis. Between 5 and 70 people per million have it.
My neurologist there at the Mayo Clinic when he said what it was, he said, I got good news and bad news. The good news is you're not going to die immediately. Bad news is you have a disabling disease for which nothing can be done. And so his recommendation was is just live life to the degree you can, learn to adapt to it. It will probably continue to get worse. We just simply don't know what your case will be like. So there was simply no answer. And so the answer was I would go get a physical on a yearly basis, but I did nothing of any substance in terms of trying new therapies, drugs, whatever. I was pretty much resigned to the fact that nothing could be done until I heard about the clinic in 2020.
My name is Dr. Nadia, how my American patients call me. I am head doctor of Lymphatech Clinic.
Even when I understood from Alan's medical records that Mayo Clinic was unable to treat his disease, my personal certainty that we could help Alan with our groundwork and technologies did not lessen a single iota. A patient with IBM is truly a difficult case. This is why we work as a team, even during the diagnostic stage, and apply multiple treatment methods with a synergistic effect. At the very beginning, we select targets, treatment targets that we should focus on to stop the disease. First of all, we need to softly decrease the aggressiveness of the immune system that sees in a patient's own muscles an enemy and attacks them. Secondly, we need to reveal all the components that prevent us from restoring the immune system and improving the muscles as organs. This is why we perform a deep investigation or checkup in the very beginning. Thirdly, we include in the list of treatment targets not only the muscles themselves, but the central nervous system and the peripheral nervous system, as well as the lymphatic system that works not only as a physical infrastructure for immunity, but also performs drainage and detoxification of the muscles. During Alan's lack of activity, the muscles accumulated a lot of waste due to his impaired metabolism. In fact, they were in a state of intoxication, so we needed to drain it all through the lymphatic system. So in Alan's treatment, we worked on multiple targets with one aim. Throughout the treatment process, when changes were necessary, we organized a consortium of physicians and quickly made adjustments to the treatment plan, adding necessary components.
A friend of one of my cousins had seen a video of a patient with Lymphatech, Alan, and they forwarded it to me, and they thought it was my disease. You know, they weren't sure, and obviously it was IBM. It was the same disease that Alan had, and so looked at the video, watched that, contacted Alan, called him a few times. We spoke about it, explained to me what he'd come, how his treatment was at Lymphatech, how he was feeling before, after, and so I got a little bit more motivated. At least there's somebody out there that could work on something. You know, it wasn't a surefire solution, but it was something positive. You know, when you're coming from some place where they don't give you any hope, you look for something. And so I was fortunate enough to be able to see the people of Lymphatech, Dr. Nadia and Constantine in New Mexico when they were visiting Alan. My wife and I went down to see them for a few hours. Although it was a few hours, it was very good, reassuring to be able to speak to them in person. They had already had my medical exams. I had emailed a lot of my medical records, so they had studied them. So we were able to discuss my problem and other things, and what they could probably do for me and what they thought I should do. And so from there we decided, yeah, we would like to come out here to try to go through the treatment of Lymphatech.
My neurologist sat me down and told me right after the biopsy that I had IBM, and he said, and there's absolutely nothing I can do for you, which was a pretty discouraging diagnosis from a doctor. One of my other doctors said, that's ridiculous. There has to be something they can do for you. And he recommended what he thought was the best neurologist in the Los Angeles area. And I went to see him, and he came to the same conclusion, that there was nothing they could do for me. A very discouraging outlook. I went back to Cedars-Sinai one more time, and they came up with some brand new orthotics to prevent me from falling, because I was falling at that point in time. You know, about 3 or 4 years ago, falls started very frequently, and the falls were very painful. It was just a buckling of the knees, and it's just without warning, flat on the ground. Well, I read about it on the Myositis Association forum website. It was titled "The Russian Cure?" Was all it was, and somebody else had seen a Facebook post for Lymphatech and Alan Spencer, and that's all it took for me to get started. So I tracked down Alan right after Thanksgiving, the day after Thanksgiving weekend. I spent the day getting in touch with Alan, and he and I have been, as I would say, the best friends I've never met yet, face to face. We've probably talked several times a week in the last 4 or 5 months. My whole career, I've been a doer, not a watcher. And having been a watcher for 7 years, I was totally ready for anything. And so I, after talking to Alan for several hours that first week right after Thanksgiving, I consulted with my friends, family members, doctors that I trust, and started to gather information about who Lymphatech was, what they do, and is this just something crazy, or is this something that is real? And after a couple of days of doing that, I could see no reason I shouldn't at least start to pursue it with Lymphatech, and I filled out the little form that's on the web page and sent it off. And I think it was all of 24 hours later, I heard back from Constantine. With he started to give me information about what he could do. And there's nothing out there. It's not hard to decide to grab for something that sounds real, and it did to me. So my wife and I made that decision pretty quickly.
When I first heard about it, I really didn't share it with anyone because I was afraid it was snake oil and I didn't want to be embarrassed. It's like I'm really afraid of being embarrassed for making the wrong choice about this. And it was honestly until about my 3rd week that I realized this is the right choice. I came wondering whether or not this was a cure and wanting a cure. And I've come to believe that cure is not the right word. As I've thought about it so much, treatment is the right word. I think this is absolutely the right treatment. I don't know of anywhere in the world I could go to get as much medical attention as I get here. I'm with a doctor focused on me and only me for 2-3 hours a day. In the States, that does not happen, especially for mere mortals.
When I first heard that an American was coming to our clinic in Russia, I was at first surprised, perhaps due to my ignorance. When I heard more about his situation, that the patient had been to the Mayo Clinic, a clinic I heard about before, but they offered him no specific treatment, I was doubly surprised.
Hello, my name is Dr. Vadim. I am a doctor of Clinic Lymphatech, Perm City. I am a doctor oncologist, and also I like to make the physical education with my patients. I want to give them some new forgotten movements of their bodies, to help them to eat, to clean the teeth, and etc. They lost their functions during this disease, and I help to improve and recover their functions.
Hello, I'm Dr. Alex. The
key is that we did not set for ourselves a goal to cure IBM at once. We saw some changes that allowed us to start a full-scale rehabilitation program. For example, we worked a lot with muscle atrophy and cortical networks, stimulating them by transcranial magnetic stimulation.
Hello, my name is Dr. Igor Zagarovni. I'm physician, doctor and oncologist. В цикле,
and the whole arrangement with patients who come to us with difficult cases of different myopathies. I am responsible for analyzing their general condition. I seek and select available pathogenetic treatment methods not usually used elsewhere, with a goal to improve functioning of different systems of the organism that will consequently lead to better state with myopathy.
I looked it over, but really it didn't matter. We showed up Monday morning and basically they took me over. It didn't matter what the schedule said, because it was the most intense, for the first 2 days especially, were the most intense 2 days I've ever spent in any medical facility ever. I mean, it's just one doctor after another. I could not keep track of them all. All of them seemed to be very knowledgeable, very caring, and they just, when one was done, we moved right on to the next one. The first day was at least 10 hours long. It might have been longer than that, as we were just one after another, be it a doctor or a technician doing an ultrasound or whatever was being done at the time. And day 2 was much the same way, with a lot of more data gathering. I mean, I had sent them a lot of information, but it was obvious that they wanted to have their own information, which makes sense. I think they took 10 vials of blood that I can recall, and did a lot of things that no one, as far as scanning me for various things, no one had ever done in my past that I can remember. So the first couple of days were super intense.
The first week is almost entirely diagnostic. Their approach is to understand the entire diorama of your body before they start doing a lot. They did begin some therapies, but they were very base therapies that first week. But you're going to get poked, prodded, fried, sliced, diced, everything. So that first week, right to left, top to bottom, front to back, they study your body. No one has ever known more about my body than they do now. And then they they get together as a group, all the different disciplines of doctors, and set a course that everybody agrees will help this body. And they told me, and what's kind of cool, in the States, when you get a test, you go home, at some distant point in the future, you hear about the test. Here, while they're doing the test, Gregoria is saying, she sees your veins are not in the normal place in your shoulders. She sees that there's plaques in your veins. And so I was getting immediate feedback during that process, and that was kind of cool. And early on, Dr. Alex said, you have allergy, deep allergy affecting your whole body. I'm like, okay. He said, what are you allergic to? I'm like, I got no idea. I'm not allergic to anything. He says, your body's fighting something a long time. What I perceive of their central thesis is that a base part of what's going on with me is my body has been fighting something for so long that my autoimmune system is kind of tweaked out of control. And if they can figure out what it is my body's reacting to, they can change the entire picture for my future.
What I was surprised was that the treatment, the people here, extraordinary. The attention to the patients. We felt at home from the first day. Very, very comfortable, and like we had mentioned earlier, coming to a different country, a small city in Russia, it's for an American, it's very complicated. I think you're worried, it's not a different language and everything, but basically most of the people here speak English. They understand enough. They were attentive to our needs, picked us up at the airport. The next day I was at the clinic. I was doing my CAT scans and MRIs and all that stuff, but it was just all very professional, very well organized. So it just made our first couple of days a lot easier. And we just kind of blended in. And it was just a nice transition into here. It wasn't, I can't tell you it was complicated at all. We never felt complicated here. They just had everything very well organized and very well planned. And like I said, from my anesthesiologist, my general doctor here, Dr. Alex, to Dr. Vadim, who was my physical therapist. He also applies the injections daily, which I don't like, but he applies them daily. And I was able to see a cardiologist here, a neurologist here, a immunologist here. So there's a good staff of medical doctors here. And they're all, although I don't see them daily, I only see a few of them daily, 2 or 3 of them daily. I know that I've heard and they meet daily, or they meet at least once a week, and they review my case, review how my advances are, any problems if I have a slight swelling, or 2 or 3 of them are looking into it. So you feel like the attention here is extraordinary. You feel like you're in good hands and someone's looking out for you.
So our job was to figure out what exactly is happening to the immune system, what are the methods that we currently possess that will allow us to influence the immune system, to put it on the leash, to tame it somehow, just to persuade it to stop attacking the healthy muscle cells. And it actually seemed to work according to the data that we have so far. There is a long way to go, but the results that I was told by the doctors we are having right now are very impressive. When Alan, our first IBM foreign patient who came down here, sent his medical record to the clinic, and it was the full pack, like lots of papers, and prior to that we asked him to, just in his own words, to explain us what happened and when it started, a whole bunch of questions. We saw that, and it's not just the Alan's case probably, that the approach is somewhat different to what we practice here. We saw that doctors tried to find a simple, probably unique or just one solution, name it a pill or an injection. And when they did not find it, they said, well, there is nothing much that can be done. Some symptomatic therapy, if you develop pain or something, if you need walking assistance, go use a cane or a walker or a wheelchair, finally, or get bedbound. But since there were no clinical trials, and it is like that currently, there were no clinical trials that showed proven efficacy of any drug agent, solid drug agent, in the setting of IBM, then the approach turned out to be the one I just described about. Don't go for anything because there is no proven tactics. And in that, we saw our opportunity. You see, our worldview in healthcare that our team has is that you need to take what already exists in the world and see and uncover the mechanisms behind the disease. So you have the mechanisms and you have the treatment methods. And just try and mix and match them. Maybe they will work out. And this is the thing that actually happened. So we saw several mechanisms behind the disease, and we found out that we have the methods that actually proven to be efficient in other diseases, but with the same mechanisms. So we put them together, combined a treatment plan, and applied it. So first of all, it was safe because the methods were proven to be safe and efficient. Secondly, it was efficient because all of them prior to that proved to be efficient. So this is the thing that we actually saw in his medical records, that the approach was like trying to find the one solution when possibly the more appropriate strategy would be to adjust, combine what you have and try to apply that. It's like we have a saying here in Russian, something like a sparrow in hand is better than an eagle in the sky, or something like that. So what we do is just we apply what we have rather than sitting around and waiting for a miraculous solution. Yet we hope it to arrive someday, because this will make the life of IBM patients and other patients with other types of myositis real easier. I mean, the exact drug that will solve the genetic problem behind it, if there is the one. But as far as we don't have it right now, we just use what we have.
First of all, we see that all our patients are in great need of help, and they have a strong motivation to live and get better. Some of them want to even resume working. This inspires us to use everything at our disposal to treat them. Secondly, we try to include in the scope of our treatment not only the myopathy itself, but the comorbidities as well, Doing so, we see a positive outcome.
Speaking about the mechanisms themselves, number one and the most important, and this one is actually vivid from the data you can Google in trustworthy sources, in cited articles. I recovered the surname of one of the authors. His surname is Greenberg. He actually did a great job, and he has been involved in that for years now, given an overview of the IBM disease and the things that lie behind it. And he actually also speaks that the autoimmunity is the exact cause behind it. So our first method was to put this immune system on the leash. For that, we do three things. We do so-called Neurocardiometabolic Therapy, which are IVs, to wash out from the tissues all the remnants of the metabolic activity or metabolic wastes, to clean the muscles. Secondly, we do anti-inflammatory therapy. We use the same steroids, but used with our own methodology, applied locally, so it doesn't affect people globally. It only acts at the site of the disease when it's needed. And number three, we used immunotropic therapy. These are the drugs that patented here in Russia to influence the immune system and to put it on the leash. You see, what happens there is that we are not able to tell you now what is the exact gene that lays behind or that starts the whole disease, but we do the immune system profiling, the cell population of the immune system, which is actually a very common method of in blood work testing, available all over the globe. And we see that there is some population of the cells that are high numbers, those are low, so we need to readjust that. There are lots of antibodies, for instance, or cytokines, and we need to lower them. That's what we do using the drugs that are patented here and the needles, actually.
We inject drugs that have an anti-inflammatory effect into the area of regional lymphatic nodes. This enhances the circulation of the lymph and allows the organism to overcome inflammation. This is the first step. Secondly, when we see a decrease in inflammation from the blood work, we then add both passive and active exercising for muscles, but only after we see no inflammation. After a session of transcranial and peripheral magnetic stimulation, we allow a certain time for the connection between the cerebral cortex to get stronger. We then start special exercising done by a different doctor to restore muscle mobility and muscle volume. Apart from that, we apply different drugs selected by our neurologists, drugs that impact metabolic activity and drugs that improve conductivity of nerve impulse and decrease other symptoms. So this is the size of the coil, with a magnetic field created inside of it, and we attach the coil to a very specific point on the head. Points are calculated manually or empirically based on contractions of muscles in the arm or in the leg. After that, we start sending electrical impulses that create rhythmic magnetic fields. This magnetic field creates impulses in the neural tissue that facilitate the formation of new connections. The neural excitement propagates in the different regions of the brain. In other words, we refresh and realign the neuronal network. We have special protocols for transcranial magnetic stimulation that ensure safety so we do not exceed reasonable parameters. The positive effects that we can create from magnetic stimulation itself fully depend on how we combine different treatment protocols.
People sometimes ask whether we have a cure for IBM. Well, I am not legally allowed to say that we have a cure, because to say that we have a cure, we literally need to have a patient who is IBM free and remains to be so for a certain period of time. Let me draw a quick example with the cancer. For instance, in the setting of cancer, once the tumor is removed, the chemotherapy is done. If a person remains for cancer-free for 5 years, only by that time, oncologists say that he's cured. And also, it doesn't mean cancer won't return in 10 years. So this is the medical background for the word cure. But what we see in the treatment results that we achieve is that we certainly have treatment that allow us to suppress the disease, and we see it in the lab work, we see it in electromyographic studies, we hear it from the patients about how they feel, what motor functions they acquired that they had lost, what are the improvements.
My attitude, my ethos is very different than many people's. I've had a tremendous life. It owes me nothing. And if this is my path for exit, okay, the world owes me nothing. So I was pretty comfortable with the direction I was heading. And I told my kids before I left North Carolina, when I get to a point where I'm not comfortable going to a restaurant because I am afraid of choking and embarrassing, I will take myself out. And I'm very comfortable with that. That's my, in Hawaii they say kuleana, my way of doing business, my responsibility. Yeah, you can do research and 1,000 times you find there's nothing, they just don't understand it, and no one's going to because there's no money to be made in understanding it. With the popular diseases, they can make money off it, they'll do it. You know, that's capitalism. I don't even know why. One night I was looking through articles and just to see if there's anything new on the whole IBM front. And somewhere in like a journal type situation, a more academic situation, one of the comments had a link on to Reddit, and it was the video of Alan while he was in bed at Lymphotech after 3 weeks. And I was like, whoa.
The medical treatment is pretty standardized. You have infusions where they put subcutaneous fluid under your skin, basically, which is absorbed and dealt with your lymphatic system. That's kind of the backbone of what they do. And that hold, the various medications, the shots and things you get are basically to realign and kind of get your immune system working properly. And then they do blood tests throughout the course of your treatment to test the efficacy of that. You have 3 main sessions during the course of a day. You have all your medication type things where you get your shots, your infusions, your IVs, and all of that kind of stuff. Then you have another third of your day might be taken up by transcranial magnetic stimulation sessions, where it is using magnetic waves to stimulate the nerves in your muscles and in your brain and things like that. And then they take all of what that does, the TMS kind of gets your body prepared for physical therapy. So you have, as they call it, they have a sweet spot of 12 hours where your nerves and your muscles are kind of ready for PT. And then they add to it now in-house PT. And so you're doing PT for an hour to hour and a half every day. But that's how we kind of go through a typical day. And it can take, anywhere from 5 to 6 hours a day at least here in clinic. That's pretty typical.
Dr. Alex is kind of my principal doctor, and he's also the one that administers my TMS, the transcranial magnetic stimulation, which is proof of how well it works, because I could not get that right for the first 2 weeks I was here. Dr. Alex is top shape. I like this guy, and would be happy to just have lunch with him, sit and talk story. Just a nice guy. He's kind of like your favorite uncle kind of a guy. And so while he's administering the TMS now, we have conversations, we share jokes. As I understand it, their thesis is that your muscles are wasting not because they're being digested, but because your brains forgot to tell them to stay alive. So this TMS helps activate that neurological pathway again. Dr. Vadim both gives me the neck injections, sets up the infusions of the stuff, and then later in the day, after you've had TMS, there's a sort of a rest period in your body. Then a window opens when your body is more receptive to building those conductions. And so you have TMS, and in my case, I eat lunch, and then Dr. Vadim comes in for physical therapy. He's good at it. My wife had physical therapy, so I've been around physical therapists. He's good at it. He's also really good at finding ways. My hands are a problem, weakness in my fingers. So he figured out he's got rubber bands that we do different. He ties them a knot and hands it to me, and I have to untie it. And that's really good fine motor work. So we get along really well. He does stuff for my fine motor. He does stuff where I'm, using gross motor skills.
The treatments starting day 3 were the transcranial magnetic stimulation, a bunch of needles with infusions or injections, and physical therapy. And then that was then augmented with other tests and more data gathering, but they got started on day 3, as I recall, with all of the treatments. All the treatments they started with. After gathering more information on me, it was on Friday, I had a sit down with Dr. Nadia, and she went through why I had IBM and what they were going to do about it. And that just floored me. Because there's no way to do that in the US. Dr. Alex is an absolute gem. He continued to challenge me during the TMS to do ball exercises to work on my hands at the same time. His mantra was "Do not be lazy," and he was so right. He set a tone really good, and a super nice man too. He was just a fantastic doctor, is a fantastic doctor to work with. My IBM, at least some possible source of it, had to do with maybe age-old infections that my body was unable to combat. There were various drugs they wanted to give me to try to fight the infections that were in there. So there were a lot of reasons to give me shots. Not fun, but hopefully they're going to work. Dr. Vadim is a really enjoyable character to be around. He's a young man, trained oncologist, I believe, who is functioning as a physical therapist. He's very personable. His English is quite good. We're making it better as we teach him slang, and hopefully we don't ruin him for other people. But he is a joy to work with. He pushes people to their limit and maybe one or two more, and we just slowly tend to get more and more done. I'm feeling quite a bit stronger now than I did before. But they also told me that my CPK went from 901 when I showed up on the very first day to 87. 87 is normal. And I haven't been normal in 10 years, I'm sure. And that was incredibly groundbreaking for me. The hope meter went off the charts for me. And ever since that day, there's nothing that's going to stop me from continuing on at this point. It was a gigantic day in my life.
Among the general criteria of inflammation, we can list well-known CRP, or creatinine phosphokinase, CPK, that we can find in blood serum. They are elevated in IBM as the muscles are damaged. So we used this criteria and saw a clear, steady downtrend. We checked them at the beginning of the treatment program, in the middle, and at the end. I also wanted to talk about another important general marker. It is an immune status of a patient that we analyze before the treatment and sometime after treatment. It is curious that in Alan's case, for example, despite not doing so well physically before the second course of treatment started, the immune status at the control point was significantly better. It included a lower amount of antibodies that are aggressive towards the muscles. It is a decrease of cytotoxic CD8 cells, CD4 cells. And we know from articles in IBM that CD4 cells can differentiate and become cytotoxic too. We did a second course of treatment and expected better results in immune system profilings. So these were some of the criteria for a patient.
Which is amazing. It feels like 4 days. When I got here, my ability to grip, to hold, was not as strong as it is now. It's not strong now, but it is definitely increased from where it was. My ability to bring my fingers all the way, actually right now, is not very good. After therapy today, I was doing better. On this side, I'm better, But a year ago, when I went to see the neurologist, this was about as far as I could go. Doing this it's an improvement over when I got here a month ago. My grip strength is definitely better, even though it's not perfect. When I got here, that first night when Gregory took me to the store, I bought a pepper shaker. And I couldn't use it. It was frustrating the hell out of me. And then about a week later, I was cooking some mince, and I picked up the pepper grinder, and I was like, I'm using it. And I was amazed, but then I realized I was using it like this, which is only half the effort of using it like this. But I could still do it. And now I could still do it. I've been here a month. I definitely could not do this when I arrived. This pile of pepper would not have happened.
Как правило,
Normally, we see an increase in muscle force, an expansion in volume of movements, an improvement in swallowing and speech. In other words, we witness better praxis of conscious and subconscious movement stereotypes.
I was before coming here, I was pretty bad off, walking on a walker and couldn't get out of a chair. So I have a long ways to go to get to the point where I could get up and wander around and do a really great moment. I don't expect to see any of that while I'm here, but I have seen a lot of improvements. I have seen that my hands, I could not do this before. It's not a fist, but it's getting closer. And my right hand is not as good because I'm left-handed and stronger over here. I have felt my legs get much stronger, but still not strong enough to help me get out of a chair yet. But I know I'm headed in the right direction. I also find that I am far more alert. I seem to need less sleep. I'm awake a lot at night, just kind of thinking about what I'm going to do next and how I'm going to plan my time as soon as I get home. Because it's just, I'm so anxious for the next stage of my life. But I've all around, I am stronger now than I was, and I believe I'm going to continue to get stronger. In my mind, the worst thing you can do is just sit there and wait for yourself to deteriorate to the point that you're beyond help. As I said earlier, I'm a doer, but you have to be a doer because nobody cares about you like you. I don't believe that Dr. Nadia would take someone on as a patient if she didn't think she had a shot at helping them. I've seen other patients here that are probably worse than me. You got to start somewhere and try to come up with a solution, because just sitting around and waiting all you're doing is getting worse. And what I found is I got worse. There are other people that have IBM that are a lot better off than I am. They're going to get better faster than I will because I'm just deeper into the hole than they are. So I strongly recommend to at least contact them and let them tell you if they think they can help you or not, because they know what they can do. And I think it's not IBM as much as probably most myositis patients.
My desire is that these patients do not become disheartened and continue to fight for themselves and their lives.
I would recommend coming here based on our experiences in the States, that there's no solution, that none of the doctors there recommend to do anything. They just want us to, we're on a wait and see basis. So I would recommend come here for about 4 or 5 weeks. Like I mentioned earlier, I do feel positive results. I'm not going to go run a marathon right now, but I think I might be able to hold my golf club a little bit better. Although my neurologist said I shouldn't be playing golf, I'm still going to try to play golf. So I think if they can afford the time and the trip to come out here, I see as a positive. I'm planning on coming back here in 3 months, because at this point in our life, if we wait and see, we're just degenerating. We're just going downhill. We're just waiting for our muscles to dissipate or or fade away. So at least I feel when I come to Lymphotech, if they don't have the cure for me yet, at least they're trying to stabilize me and keep me from deteriorating so fast. And that's my idea. That's my thinking. That hopefully, if I come out here twice a year, if I can, I'm gonna try to stabilize me at least, while maybe hopefully in the States or somewhere else they do find a cure for this disease. But for now, I recommend it for anybody that has it to come out here. Like I said, it was a positive experience. I do feel better. It's slightly better, but obviously every person is different. But like I said, my fingers are better. They're a little bit more flexible. My walking is a little bit better. My wife was telling me when I first came, I was walking like a robot. At least now I walk a little bit more normal, not so stiff. And so there's just slight things that get you more motivated and more positive thinking. So I like I said, overall experience excellent, and I'd highly recommend it.
I want to say that you must not lose heart because it's a slow-acting disease, and it's in our power to counteract it and work towards a good quality life. We don't have to lose time while looking forward to the discovery of more specific treatments sooner or later.
They're not saying they have the answer, but they have the best focus I can imagine anyone getting. They have doctors. I like all the people here. Not that means they're any good, but it's sure nice to work with people that you like and people that you believe want to help you. I would think it's worth the time to ask them if they could help you, because you're not, even if it's something they can't cure, they can probably help you deal with it. Maybe they can help you get better to some extent, but I'm an evangelist for the place now.
Most of the guys who have come here, our discussion has all been around the thing, we're tired of having no hope and having things simply go downhill and get worse and worse and worse and never change. So for us, incremental positive change and slowing the process down, perhaps reversing some of it, is worth the investment we have to make. And that's why we've all decided to give it a shot. Well, I would say that there have been, certainly it's a positive thing in your life if you can see improvement. I mean, it's a debilitating illness that wears you down. Truthfully, it wears down your caregivers just as much, if not more. And if it weren't for my wife and my son, in particular, my son's taken 3 years out of his life to help. You know what? Do it. If you do it for yourself, that's great. Do it for them too, because if there's any benefit, they're going to benefit from it. The other thing that has been a tremendous blessing this time around for me is to meet people personally who have IBM. It's a very lonely disease because where you live, you may never meet another IBM patient in your life unless through some very extraordinary circumstances. And so I have met 3 other guys with IBM here personally, and the connection that you get when there are other people that you can talk to who can have experienced what you've experienced, we have very much connected in terms of that respect, because, I just thought I would never meet another person with IBM. So the clinic has helped bring us together. Now, there's no guarantee there'll be other people here at the time, but I wouldn't be surprised, given what I've seen, that the snowball effect, that there are at least 2 or 3 others that are coming here now in the next few months. And these other 3 guys are all coming back September, October timeframe, I believe. The chances are pretty good you're going to be here when there's somebody else with IBM. And so that's it. That's a positive, because you can share experiences, you can encourage one another, you can see how other people are doing, realize you're not alone.
Treating patients with IBM and other neurological degenerative disorders, we have clearly seen the following. First of all, the cause is autoimmunity, aggressive autoimmunity. We now firmly believe this. Secondly, it is undoubted that genetic background is compromised as well. However, we can look for the exact key gene forever, and at the same time, a patient may literally fall apart. Muscles will deteriorate, muscle mass will progressively diminish, while we all look for a single gene that may or may not exist. So since our very first patient, we know that we must act now and treat patients with what we already understand. We must influence the pathogenetic target that we have already identified and clearly see. This is all done to stop this aggressive autoimmunity. So our credo is that while a person is alive, we need to step in and act with all that we have, with what we understand, and what has proven to be efficient in other diseases. In this case, we have yet another confirmation for our approach to autoimmunity. I want to say to doctors, you should never get obsessed with the knowledge and experience you currently possess. Learn and learn continuously. Learn, learn, and learn. Discover for yourself the lymphatic system, and especially its role in our organism, a role that is multidimensional. You will be enriched with a better understanding of how to treat any pathology, and not only autoimmune problems, my dear colleagues. Never tell your patient you cannot treat the disease, because even if you don't have a magic pill, you still have a chance to influence the mechanisms of how the disease develops and stop the disease from progression and maybe even to reverse it. Seek and you shall find. Never back down. Never give up.
Suppose you now watch this video and you have an inclusion body myositis or somehow related disease, and you think that, well, probably it is worth trying even just to check out, maybe to write to the clinic. I just encourage you, just go and write to us. Select the form which is appropriate for you, the method. Phone call, email, text message, WhatsApp, Viber, Telegram, Skype, whichever is convenient for you. There is a chat form on our website. Just start communicating with us, and it will help you to figure out whether it is worth trying or not in your personal situation. And our team of doctors is welcoming you to fight for health, to uncover the reasons behind your condition, and to help you with everything that we have here.
It's good to be here a second time. I feel like a proud parent in a way, because most of these people are coming here based on my own experience with the clinic and the fabulous job they did with treatment, and just their thorough evaluation of my situation. And I'm glad to be back. I'm coming just kind of for a tune-up. But to be frank with you, part of the reason I wanted to be here is I really wanted to connect with all of the other people that had IBM, because before this disease and our time together, I never had a chance to meet anybody else who had it. And so we become friends, and I just wanted to connect with them personally, as well as get a bit of a tune-up and see how much better we can get.
Well, we came here to see if I can get some improvement on my health. I don't expect miracles, but I expect, I'm hoping to have a little bit more strength, a little more confidence in the way I walk, and just in general improved health. And so far, for the first week, I feel better. I'm walking easier, and maybe it's just a little mix of the tension and the physical therapy and some of the medical treatments. Basically, I'm hoping now with the 4 or 5 more weeks that I be here, I should improve much more. I find Perm a very nice place to come. We were very surprised with the people. The attention from the clinic is excellent, far more than we expected. Thank you very much. And overall, so far, very pleased with everybody here in the city itself. And a lot more modern than we expected also.
The people at the clinic, as you've already heard, are fantastic. The people of Perm are really nice. I found exactly one person who wasn't totally friendly and absolutely willing to help me. All I have to do is show them my translator, and they'll read the Russian, and they'll do what they can to help you out. Now that it's greened up, it's become a really beautiful city, and I'm not anxious to leave. I'm actually looking at buying what they call a dacha, kind of like a crummy country house. because the prices are very fair, and if I come back for treatment, then I can go there and hang out, and I'll be very happy to do that.
Well, the one thing I'm going to miss from Perm are the people in the clinic. They were fabulous, and I just feel like I'm friends with all of them, and I'm going to really miss the people.
What we appreciated so much was the fact that you're so thorough and you got to the bottom of the problem that Alan was having. And also, we love the people. You are our forever family now.
I gotta say, first and foremost, that the people here have been really outstanding. It's been a singular attention to people's care and a personal commitment to actually making sure people are seen to, not just at the clinic, but in their day-to-day lives. I can't say enough good about how much they've done. The city, boy, it sure is nice to see it in green instead of in winter. And the people here too have been excellent as well. So that's what I would say has been the most defining aspect of the experience for me, is just the quality of the people.
I know a lot of the people here have talked about the quality of the staff, and I certainly echo that, because they're certainly just top-notch, caring people. But I'd like to go in a little different direction and honor the gentleman sitting on my left here, without whom we, all of us here, would not have been here. He's our pioneer. He launched out long before any of us ever knew anything about Perm or Lymphotech or anything. And Alan, without you, sir, our lives would be tremendously worse. And we really, really do appreciate everything you've done for us.
Thank you very much.
Well, one thing for sure you need to know is, if you go out to dinner with Constantine, make sure you make him order all the appetizers, because he is excellent at it, and it's his good job, because every time we've gone out, he's ordered the appetizers. And where we're sitting, I'm looking at the bridge, the park. This is beautiful, a beautiful walkway along the river. This is the best place to come if you come to the clinic, is down by the river. It's just wonderful.